When a baby is born in need of extra special attention, the Level 3 Neonatal Intensive Care Unit at Providence St. John's Health Center brings together medical and nursing care with the latest technology and support to create a place where newborns and parents can thrive. From the moment of arrival, our team of exceptional physicians, nurses, respiratory technicians, and other care providers respond to a newborn's needs with the expertise and compassion that such vulnerable patients require. The same quality and compassionate care that has defined St. John's for more than 70 years. We provide our patients with the most advanced and accurate monitoring and assessment technologies, while our state-of-the-art neonatal beds provide a healthy and warm environment for babies as they grow and improve. A wide range of respiratory systems are ready to assist with an infant's breathing, and our facility is equipped to accommodate neonatal surgical procedures with minimal disruption. A baby's stay in the neonatal intensive care unit is a stressful time for parents. That's why our family-centered approach welcomes and encourages the presence of parents as a vital part of their baby's care team. Ideally, no parent would find themselves and their newborn in need of the kind of extra special attention our neonatal intensive care unit provides. But when such needs occur, Providence St. John's Health Center has created a place that combines technology, training, and support for the health of infants and parents throughout Southern California.